cost and availability.
We all know this is urgent. And unfortunately, over the course of the year, despite all the hearings that took place and all the negotiations that took place, and people on both sides of the aisle worked long and hard on this issue, and this became a very ideological battle. It became a very partisan battle, and politics, I think, ended up trumping practical common sense. Then the money that they are spending on health care is money that otherwise could have gone to job creation. And I don't need to tell people here. So part of the goal here, I think, is to figure out what are the areas that we do agree on, what are the areas where we don't agree, and at the end of that process, then make an honest assessment as to whether we can bridge these differences. I don't know yet whether we can. My hope is that we can, and I'm going to be very eager to hear and explore how we might be able to do so.
It's important for people to understand there's not a presidential bill. There are good suggestions and ideas. Our view, with all respect, is that this is a car that can't be recalled and fixed and that we ought to start over. But we'd like to start over.
Well, thank you, Mr. President. Thank you for doing this. It was not produced in that fashion. It was produced behind closed doors. It was produced with unsavory, I say that with respect, deal making.
We're not campaigning anymore. The election's over.
I'm reminded of that every day.
With our respective talking points going back and forth, we were supposed to in Medicare and Medicaid in our budget. Mike Enzi, who's worked on